Dr. Ricketts, can you help me make it through? Dr. Ricketts, can you teach me something new?
He's Dr. Mark Ricketts, the Doc On JOX, who's been with us for many, many years. Your phone calls with the Doc On JOX at 741-9450 and around the great state of Alabama on the UMP and Sports Radio 740 at 1-800-239-9569. Anything medically going on in your life? Any questions you've ever had? We'd love to hear from you, and the Doc On JOX will take care of that on Twitter as well at JOX Roundtable. Doc, how you doing, man?
Doing super. How's everybody else doing?
Awesome.
Yeah, it's been a pretty good week so far. Pretty good week.
And let me, as an Alabama fan, I want to begin today with congratulating the Auburn Tigers. What a great victory. Wish these guys nothing but the best this weekend. Proud as I could be of our guys. Pressure just got to be too much. I mean, there's a reason Coach Bryant never was able to do it in two or three different attempts. But we listen. Proud of Coach Malzahn and everything the Auburn Tigers did, and we really support these guys and hoping for a big victory this weekend. State of Alabama is going to be the ultimate winner out of this thing, guys. I mean, listen, we got both teams from the state of Alabama that are going to be playing in BCS Bowls. That is pretty remarkable. That is pretty remarkable.
So that's, of course, this weekend. For you specifically, you are here to talk to us about some weight shockers is how you've laid this out for me here. Explain to me, this is food or drink that puts on weight?
It's all kinds of things that put on weight during the holidays. That's reason for most people. I don't really want to start the diet issues with most people losing weight till after the holidays because it's just fruitless right now. And we're going to throw out some things that you would not think of that would be common causes.
Okay.
So white chocolate bread pudding we had for lunch.
Yeah, that's going to do it.
Well, if you go out and run that 4 miles, Lancey, it'll be just fine. Thank you very much, sir, what you're doing. You're looking quite trim.
Well, thank you, Doc. I appreciate it. I already got my run in this morning.
All you guys are looking good, even with Brownie getting ready to have that baby.
That's right.
Everything's looking good. Anyway, here's some things real quick. Most of these are related to cortisol, which is a hormone produced by your adrenal glands in your body.
Okay.
Number one is stress. Everybody under stress from shopping, being out driving,
Kick returns,
or being the kick return back, whatever. But anyway, stress, that cortisol will actually, for most people, make you convert sugars into fats, and it'll hang on you, and you'll gain 3 or 4 pounds just from doing it. Lack of sleep. I don't know about you guys, but I'm pretty much sleep deprived for various reasons these days. But lack of sleep with everything going on, trying to, I listen here. We got bowl games, championship games, all the stuff we do this time of the year between now and in January that we're going to be going on here. Shifting gears for basketball. Of course, we got our ice picks. We're going to start ice picks next week.
Good. Well, Dave, what is, and this is different, but I mean, how many hours a night? I mean, is 6 enough?
7.
I think most people, 6 for most 40-year-old guys is probably plenty. You probably need 8 when you're an old guy like me.
But can you make it up if you get 5.5, 6 throughout? You can't get one of these days where you get 9 or 10.
There's no such thing as making up sleep. And the worse you get your night rhythms off, your circadian rhythms between day and night cycles, the worse that gets. Right now, too, lack of sleep kind of messing with everybody because we're heading into the shortest day of the year, starting December 21st. Days start getting longer. Things start to get better. With all the stress and lack of sleep comes a common item this time of the year we deal with, which is depression. Now, it's not the most common time that people will succeed in having suicide attempts. That usually is in the spring. But as you move into this time of the year, depression is a big deal. We're 6 weeks out from the time changing. It causes a lot of stress. People go on antidepressants. I don't care what you do, most of the antidepressants, irregardless of what you do, are going to make you gain weight.
See, I'm very stressed. I never sleep enough, but I'm okay. I'm not depressed, so I'm good so far.
Yeah, yet. Okay. All right. Anyway.
You're just what we call moody.
Yeah.
Bipolar.
Yes.
Well, they used to call me Dr. Jekyll, Mr. Hyde, if that makes you feel any better. So it's how it is.
They just call me Jekyll. I don't have a degree.
There you go. Listen, steroids. A lot of folks this time of year, you're coming in. It's unfortunate because we're going to give them to you. You're coming in with colds. By the way, we saw our first 2 cases of documented flu this week, too, by the way, guys. Yeah, so it's out there, too, now. But you're going to get steroids to open things up this time of the year. A lot of folks having arthritic complaints and those sorts of things.
And that makes you put on weight?
It makes you put on weight. I don't care what you do, it's going to happen.
So let's say I was with the Pittsburgh Pirates and then I took steroids. My head would be literally bigger and fatter by the time I was with the Giants?
Yeah, no doubt, yes. Good old Barry.
It puffs you up a little bit,
It
is what
does.
you're saying, yes.
Henry Aaron's still the home run king, by the way. Okay. Drugs for various conditions. Migraines, a lot of migraine headaches with the weather changes right now. Seizure medications, some of your high blood pressure medications, some of your diabetic medications you deal with will make you gain weight. So you got to watch it.
But you have to, I mean, you need those drugs more than you need to worry about weight, right?
Absolutely. And you work with your doc. We're going to work with that. Hypothyroidism or an underactive thyroid, always year-round a common cause of gaining weight that you're not aware of. Cushing's syndrome, it is a disease where you're producing too much cortisol and you get fat kind of in your middle and you get the purple streaks if you're really putting it on. But that's a real common problem.
And it's called what?
It's called Cushing's syndrome.
Cushing's syndrome.
There's treatment for that?
Oh, absolutely.
Okay.
Yeah. Now, President Kennedy had the opposite of that. He had Addison's syndrome where Addison's disease where he didn't produce enough cortisol. This is when you produce too much. Polycystic ovarian disease for a lot of our ladies out there. Got an imbalance of their eggs migrating and opening up, and you produce too much of an androgen, which is a male hormone. You get the body fat in the middle, you get the migraines, you'll get hair growth, you get the face breaking out. All those things are common causes, and for whatever reason, this seems to be a real common time of the year that tends to manifest itself. People doing good acts. People trying to quit smoking. They try to start in the fall. They're usually doing pretty well up to now until they'll fail during the holidays. But that when he stops smoking, those taste buds come back alive. People tend to pick up the foods and will gain a bunch of weight. Let's face it, everything we eat this time of the year is highly caloric and is going to affect you and that sort of thing too. But those are some real common weight gain shockers. What I recommend to most everybody, how to fix most of this, there's really behavioral modification. You know me, diet and exercise. I just tipped the 80-pound mark the other day on my weight loss in the last 17 months. Just got into a size 34 blue jeans.
How about that?
From a 42 that I wore before.
Jeez, Doc.
And
I didn't know you were 42.
Yeah.
You've lost 80 pounds.
I've lost 80 pounds since
when you
we started.
When you see somebody every week, you don't notice it as much.
Yeah, it's John Saber, 76 pounds.
Yeah, Johnny and I are right there neck and neck with each other on what we're doing.
Now, your head about 4 pounds. I mean, there's no sugarcoat that.
At 50, let me tell you, as you get older, that's hard. But we're going to do those things. Dealing with the stress, dealing with all this other stuff is going to be a big help too. So you do all those things. We'll fix it after the holidays. Let's get your mind right. Let's try to be as under stressed as we possibly can. And the rest of this stuff is stuff we can take care of. But those are things just to be looking out for. If you are gaining weight, don't get depressed. Don't go be pulling out a new wardrobe. We're going to shoot for the spring wardrobe. And we'll take care of it. But that's just a common list of things that I run into on a day-to-day basis that cause these problems.
All right. So the Doc on JOX is with us. That's great information there. We'll do the Scholar Athlete of the Week in a second and tell you how you can get in contact with the doc to make him your primary care physician. Let's knock out a call or two before we take our halftime break here with the Doc on JOX every week. We'll start with L Train, who is up first. Hey, L Train, how are you?
Hey, guys. Doing all right?
Doing great,
man.
Hi, Doc. What's going on?
L-Train, listen, just pulling out of the station. What's going on?
All right. Good deal. Good deal. Funny story real quick about the shot caller and the NFL coaches. That would be an unbelievably great tactic. We had a buddy of ours. We will call him Seth because that's his name. Actually, overindulged a little bit at our house back in the day. And, he did it in the worst possible spot in the backyard. So all we had to do was pull the collar off the beagle.
Oh, my.
And, yes, we pulled it off, drug him over there and opened the gate for him, which was probably the best thing we could have done because as soon as we pulled him to the perimeter and it shocked the mess out of him. He gets up, takes off running through the gate, which was the worst thing he could have possibly done. And it got him probably 6-8 times.
That is hysterical.
Oh, man, it was fantastic. But on a medical note, Doc, I've been waking up lately a lot with some joint stiffness, especially in the mornings. And, man, and you're going to love this, too. I do my PE stretches every day, with the neck rolls and the arm rotations, everything like that, my shrug.
Yes.
And it seems to help a little bit, but is there something else I can be doing? I turned 34 this year, and it's just something, I'm starting to notice.
It's real. Actually, this weather, it's kind of crazy, but and nobody's going to give you documented scientific data on it, but I'm going to tell you, drops in barometric pressure for most people tend to bring this kind of thing on. Maybe a lack of activity also makes them stiffen up a whole lot, but this change in barometric pressure in the weather is notorious for causing this problem. And, as I always say, dehydration, not enough drinking of water. You don't produce enough joint fluid when you do that, and all that will mess you up.
Okay, so is vitamin water? I mean, I do stick.
Vitamin water is great, man.
I drink too much soda, I think. You know?
We all do. Because we're all sitting here drinking Diet Coke. When I listen to Lance and Jim have waters.
We're all water.
I've got a water right here, but I do have the Coke also. So
I'm the one doing the Diet Pepsi here. So
anything else I could be doing, though, like I said, I just try to limber up the best I can. And I have noticed it the last few weeks a little bit more. So.
Yeah, and I'm seeing it in the office all the time. So this is just common stuff. But really, stretch well, hydrate well, so we don't tear tendons or ligaments or end up spraining something and putting you out of commission for a couple of weeks.
All right, L Train, thank you. One more before the break. Jeremiah in Birmingham. Hey, Jeremiah, how are you doing?
I'm doing good. How you guys doing?
Doing well, man.
How you doing, Doc?
Jeremiah, never better. How about you?
Pretty good. I was just inquiring about I was trying to get a primary physician. I was trying to see what was the procedure on contacting you, getting information or anything.
Yeah, I get asked this a lot, though. I know Lance will give us the contact, but are you constantly taking new patients? Are you full or what? I get asked this a lot.
I think that's a great question. A lot of doctors do limit what they do. There's pros and cons. I have never closed my practice in the 25 years I've practiced to taking new patients. And the reason why is if somebody needs, I took the philosophical decision that if somebody needs my help and they come to me, I'm going to do the best I can to try to help them. And you got to think, in a medical practice, there is turnover. In a metropolitan area like Birmingham, you've got people that come in and out of your practice. They move. They may not like what they're getting. They may find somebody geographically closer to them. People die. I mean, that's sad to say, but, you look at the obituaries, they were long today. So we're always taking new people. And, right now, if we've got room, we're going to take you. There's certain things we probably aren't going to touch. But, that was just my philosophical decision, right or wrong. I'll either take credit or the heat for it no matter what. But we'll always take people. And, Lance, if you need to get in touch with us.
With that said, Jeremiah, really simple. Make the call today, 822-0233. We invite you to check out the new facilities at the Vestavia City Center. Beautiful place over there. Stop by, get that 2013 medical guide, which has got tons of information, 822-0233.
All right, Doc, can we do Scholar Athlete here before we go to break so we have maximum time when we come back? The Scholar Athlete of the Week, Doc likes to recognize people who gets it done on the field and in the classroom, helped out by our friends at AL.com, the Birmingham News, with some good information of a great athlete.
Yes, listen, and I apologize if I mess up the name. Riordan Wyatt from Homewood High School. She is a cheerleader. She's the co-captain of the varsity cheerleading squad. She has an outstanding 3.92 GPA, scored 26 on the ACT. That is nothing to sneeze at. She's a member of the Student Government Association, Key Club, National Honor Society. Shooting high, she's shooting for William and Mary or Elon. And I love her enthusiasm. She plans to cheer in college, either from the sidelines or in the stands. She loves Spanish and history, wants to go into journalism and communications, loves the Vet Brothers, and Spoon are on her iPod.
Good stuff there. Doc on JOX when we come back. We'll say quickly on Twitter before we get back to the phone. Will writes in, I have a staph on my leg, and I've taken a 7-day dose of Bactrim. It is better, but not going to get it all done. What should I do, Doc?
Do it again. It's not long enough when you're dealing with a staphylococcal or staph infection on the skin. And particularly, they're probably covering for the bad staph that's resistant to so many antibiotics. You got to go longer, particularly on the legs. I do at least a 2 to 3 week course on that. And you stay with it until the person is completely healed.
Danny in Gardendale says, can you get the doc to talk about shingles, and can a field goal kick return for a touchdown cause it?
Well, let me tell you. All right, let me do the first question first. Shingles is where you had chicken pox as a kid.
Right.
And you never throw that stuff off, and it lays dormant in these nerve ganglions around your spinal cord, and you get under stress, you get sick, that your immune system will actually be tapped down, and that virus will begin to replicate and actually goes down the nerve root and causes damage. That's where the pain's coming from.
Back to stress again. Stress on the weight gain, stress on the shingles.
And we got to watch that, because starting in 94 when Polly was grouped, that was a mandatory vaccination against chicken pox, and you have to do it every 8 years. So we got a whole generation coming along that maybe won't ever have shingles, but if you don't keep the vaccine going every 8 years, what may be even worse is you get chicken pox as an adult, which can be lethal and cause a lethal pneumonia. And let me tell you, I had a little burn going down my right thigh, and it wasn't from excitement the other night, but yes, stress definitely could be causing that, so you're all on top of it.
Yeah, stress is everywhere. Let's go to Johnny in Pinson as we rock the phones here. Hey, Johnny, you're on with the Doc on JOX.
Hey, Doc. I was wanting to know if you were familiar with the Sinclair method, or if you've ever heard of the Sinclair method as a kind of a method of using a drug called naltrexone for treatment in problem drinkers or alcoholics.
I think you emailed me this week, and I'm sorry that I didn't get back to you because something happened with my email, and I accidentally deleted it. I'm very familiar with the Sinclair method. Anti-abuse works very well, but you got to do that in the hands of somebody that really deals with this kind of thing. Still, the thing I talked about with alcohol is you got to get in the hospital and you got to take that 3 days to detoxify and make certain that you don't have a life-threatening seizure or other neurological event that occurs from the alcohol coming out of your system. Now, once that's done, using the Sinclair method, it will work. I believe using that with Alcoholics Anonymous, those programs are extremely effective. Antabuse is another great drug that you can do with it. There is another drug called Cambrel that is out there you can also use to prevent you from wanting to drink and also, making you throw up your cookies basically if you do. But those methods do work, but you still need to do the in-hospital detoxification program for 3 days before you do it. And that's the one substance withdrawal thing that you just absolutely medically have got to do that.
Okay. I've already been detoxed for about 14 days.
Okay.
It's not really medically that I need to drink. I don't have any withdrawal symptoms. Alcoholism runs in my family.
Yes.
And I can already kind of feel, I don't have a problem quitting drinking for days or weeks at a time, but when I do
it's a long haul
again,
thing.
the desire keeps increasing and increasing. And the Sinclair method, it seems to mention that when you take the naltrexone or whatever, it basically over the course of months kind of cuts down that desire to drink because you drink while you're on the medication. Contrary to what antabuse, you can't drink while you're on the medication.
Absolutely, and there's a lot of there's some good scientific validity that might actually work, but you got to have that support system in there too, And I'm gonna tell you, the system with Alcoholics Anonymous, it works. It's been there forever. It's time tested and true, and I'm just a firm believer in the STEP program with that too. So, best of luck to you. I hope this works out, and if we can ever help, just feel free to tweet us back or call us or whatever.
Johnny, thank you, man. Keep fighting. All right, G-Man is next with us. G-Man, how you doing?
Hey, Doc, how you?
Doing great, man. What's up?
All right, thanks for taking my call. Hey, look, I'm from the old school. I'm 66 years old, but I've got a granddaughter that's 14 years old. She's a big-time softball player, but she is small, but she's fearless. And if you haven't seen these girl softball players lately, they're giants.
Yes.
And she seems like she's in a different world, but she's wanting to get stronger, and we're trying to find out what food supplements are that you can buy far as muscle building and things like that, and is 14 too young to be thinking about her muscle growth?
Well, let me tell you something.
I'm going to hang up and listen to you.
All right, thank you, G-Man.
Yeah, G-Man, that's great. Listen, let me tell you something. 14 in a boy, yes. 14 in a girl, absolutely not. I mean, the girls at 14 are probably about a year ahead of the guys in physical, muscular development at that age. Now,
so you're saying it is safe at 14?
It is safe
in a girl.
It is safe in 14 to do a weight program. Russ Behemoth and the guys over there are great at doing it. I wouldn't do it unless I worked with somebody that specifically worked with teenagers and particularly young women in that development, because you can cause menstrual irregularities and a whole lot of other issues that can lead to stress fractures and other things too. The size issue is going to come up. You're going to see that catch up. Don't sweat that at 14 yet, okay? That's going to get a whole lot better. As far as these protein supplements and stuff, I'm not a big fan of that in kids. I'm not a big fan of that in adults. I'm really not. If you're eating a really good nutritious diet and you're eating more calories, like maybe 2,500 calories a day, which a kid at this age is probably fairly normal because they're just chewing up calories right now as they're moving into adulthood and stuff. Yes, there is a lot of size issues in these young ladies. Every time I watch the College World Series, I see my cousin Leilani Ricketts out there at Oklahoma, and I'm thinking, boy, she's from Ricketts stock. Okay, I'm gonna tell you what. But listen, I'll take the mental attitude and the fearlessness and the strength and the agility and the speed any day over the size.
Yeah, she'll find a place on a team. There are different roles on a team. Look at Russell Wilson Monday night.
Yes.
He's too small to play in the NFL. I don't know if you
Don't
heard
tell
that.
him that.
Yeah, don't tell him that.
Bill in Birmingham. Bill, how you doing?
Good. Happy holidays, Doc.
You
How
too,
doing?
man.
Well, happy holidays to you, my friend.
My wife and I have these symptoms: sore throat, congestion in the head and the chest,
Yes.
and coughing, real lot of coughing.
Yes.
What's the diagnosis and what's the cure? I want the cure.
Well, listen, this is a slam dunk, man. This is like Dr. J going to the basket. Listen, it's being caused, it's a sinusitis and bronchitis that's going around being caused by a little bacteria known as mycoplasma that's going around right now. It causes a lot of sinus irritation, a lot of bronchial tube irritation, even to the point that people will have asthma and wheezing with it. The treatment, at least what I have found to be most successful in individuals, is a combination of Decadron and Rocephin shots. I do that to get you fast loaded and get you back up on your feet in the office, followed by a 10-day course of zithromycin. Now, you may be used to hearing that as a Z-Pack, but we're going to go 500 milligrams of zithromycin for 10 days, along with good hydration, some sort of cough control. And if you'll do those things, it's all statistical. I don't know what the odds would be if we were out at the book in Las Vegas, but you're going to stand probably a 90-plus chance that that's going to get you resolved within 1 week, and you're going to feel a whole lot better within 24 hours. The reason I urge people, don't try to ride this stuff out. Again, influenza A is in the community. It is documented. The health department's tracking these cases down. It has started. And if you get beaten down so bad with this, you're going to pull your immune system down. You're also going to damage your airways, and it's going to make you really susceptible to picking up the flu. So that's what it is. That's how you do to cure it, and you should be fine.
All right, Bill.
One quick question. That first name, Decrodontis, what was that?
Decadron. It's a steroid.
Decrodon?
Decadron. Decadron.
All this has to be prescribed by a doc, right?
Unfortunately, yes, sir.
Got to go see the doc.
Go see him, Bill.
You got to come see us. And what's that number, Lance?
That would be 822-0233, 822-0233.
And that's our time with the doc this week, 12:30 on the show. If you would like to check out the doc, the primary care physician, but 24 hours a day, including some great questions online that you can email the doc. I'll throw them out to him, but it'd be better if you email him now so we can answer you before next week. 24 hours a day online. It's
at markrickettsmd.com. You can follow us on Facebook and Twitter and be watching for our weekly posts by my great friend Harry Long, and always putting up good stuff for us.
Herm